Hi guys, welcome back to the channel. Okay, last class we have started that in some cases we can go for immediate reconstruction, and the mucosa we can remove tooth also, and then we will let the mucosa to grow, and then we will remove the tumor or resect the tumor when the ridge mucosa is healed through a transcutaneous approach. But this approach is not for all. Okay, so this approach produces excellent reconstructive result and has not been associated with recurrence, but applicable only in cases where tumor must be confined to the central part of the mandible without extension beyond the cortex. Okay, it is only applied to the cases where tumor must be confined to the central part of the mandible without extension beyond the cortex. मतलब कोई perforation नहीं होना चाहिए. So mandibular resection also may be accomplished from a transoral approach. We have seen peripheral resection. Both subperiosteal and supraperiosteal dissection may be performed in this manner. We have seen this. We have completed peripheral resection. Okay. Now coming to the reconstruction. We have started reconstruction. We have seen this कि when the minimal buccal expansion is there and when buccal expansion is significant, तो पहले अगर मिनिमल होता है तो रिकन्स्ट्रक्शन प्लेट दे सकते हैं पहले, बट अगर एक्सपेंशन है तो पहले रिसेक्शन करते हैं. ओके, नाउ कमिंग टू द रिकन्स्ट्रक्शन. रिकन्स्ट्रक्शन ऑफ बेनाइन ट्यूमर डिफेक्ट्स ऑफ मैंडिबल. In most benign tumor defect, the rigid reconstruction plate provides excellent stabilization, function and contour. It is infection free and contamination free. So rigid reconstruction plate we use. Now autogenous cancellous marrow graft or tissue engineer equivalent include transplantation or chemotraction of viable osteocomponent cells and achievement of natural contours, bone height and stability. इसलिए autogenous cancellous marrow graft यूज़ करते हैं. If transcutaneous approach is necessary for continuity defect and maxillomandibular fixation is required. We have seen this in the previous class about the transcutaneous approach. Now autogenous cancellous marrow graft use करें because it includes chemotraction of viable osteocomponent cells and achievement of natural contours, bone height and stability. Free vascular fibula graft is generally used for cancer defect due to small and straight nature of the fibula. So free fibula graft we mainly use for the cancer defect. Now tissue engineered graft, that is 12 mg of RHBMP, that is recombinant human bone morphogenic protein. So 12 mg of RHBMP 2/ACH combined with 10 ml of bone marrow aspirate concentrate and CCFDAB in continuity defect of 6 centimeter or less. Okay, so this we have also studied कि ये मटेरियल हम लोग यूज़ करते हैं ड्यूरिंग पेरिफेरल रिसेक्शन. वी हैव सीन दिस. We have used recombinant bone morphogenic protein and cancellous freeze-dried bone we have used, and we use bone marrow aspirate concentrate. So in 12 mg of 3 RHBMP 2/ACS, that is acellular sponge, combined with 10 ml of bone marrow aspirate concentrate and CCFDAB in continuity defect of 6 centimeter or less. This is equivalent to autogenous cancellous graft. Okay, and titanium mesh with plate is also used for reconstruction. Now spontaneous bone regeneration in youth. Individual younger than 17 years retain sufficient native bone regenerative capability. In this age group, reconstruction plate is removed after 1 year and no bone graft, a much smaller bone graft or complete bone graft is required depending on the cases. This regenerated bone is fully viable and functional. In peripheral resection as well as some continuity resection, the inferior nerve can be preserved as they do not invade the nerve. Intraneural invasion is absent in benign neoplasm or odontogenic neoplasm. Nerve pull-out approach and nerve grafting to allow a return of lip sensation. So, preservation is done through a process called nerve pull-out approach or nerve grafting. Okay, that's all about reconstruction and resection in mandible or in. We have completed this. Next class will be starting and dealing briefly about the benign odontogenic neoplasm of maxilla, as in their treatment plan. Till then, like, share, subscribe and comment. Bye.